There's a lot of confusion about Pap smears. Pap smears are a cervical cancer screening examination, and they're often done during a speculum examination. Now, when you come to the OBGYN for an annual exam or for a problem visit, you'll often receive either a bimanual examination or a speculum exam. But the Pap smear is a specific cervical cancer screening test. It is performed by using a small plastic gentle spatula and a small sort of soft thin brush. We use those devices to lift some cells off of the cervix, and we can send it off to the pathologist to be reviewed. The pathologist will review the slides of the cells and be able to tell if there's any precancerous changes to those cells. That's termed dysplasia. Now, if you're found to have dysplasia, additional screening is going to be necessary. It may be in the form of additional Pap smears at shorter intervals, or you may require a microscopic examination of the cervix called a colposcopy. Biopsies can be done at that time. Additional treatments are sometimes necessary, but not always. The guidelines for Pap smears are organized by the American College of OBGYN. The latest recommendations say that Pap smears should begin at the age of 21, no matter when the first onset of sexual activity, and are done every 3 years until the age of 65. If co-testing is performed with the HPV virus test, then Pap smears can actually be done every 5 years. If you've had a hysterectomy for any reason other than cervical dysplasia, Pap smears are not necessary after the hysterectomy. Now, there are special populations of people that may require Pap smears a little more often. For example, if you've had cervical cancer, or if you're under treatment for cervical dysplasia, or if you're immunocompromised in any way, specifically HIV or other cancers, then Pap smears are going to be done more often. Patients are often skeptical about the newest guidelines. We're used to having our Pap smears done every year, but the truth is the spacing of the Pap smears is really well justified. Abnormal Pap smears are generated from the HPV virus. In fact, 99% of cervical dysplasia is HPV-driven. Well, HPV is a virus, so our natural immunity is able to combat that virus if we give it enough time. When we do cervical cancer screening more often, we're picking up new exposures to the HPV virus that we're not giving the body enough time to combat. In fact, if you give the body enough time, 2-3 years, sometimes cervical dysplasia can be completely reversed. By the guidelines changing, we're able to pick up those patients that have true abnormalities and require additional testing and treatment. By doing this, we have decreased the number of invasive testing and procedures, especially on young women. This is really important in women who are not completed childbearing yet, because cervical treatments can jeopardize pregnancies, specifically in terms of cervical incontinence or possibly preterm delivery. Additionally, there has not been any increase in the number of cervical cancer deaths since the guidelines have changed. That said, the Pap smear is specific for cervical cancer screening. It does not evaluate for other forms of cancer. Therefore, it's recommended, and we highly encourage you to keep coming to the doctor every year for a comprehensive well-woman examination. When you come to the gynecologist or to the primary care physician, you'll have the vulva, vagina, cervix, uterus, ovaries, rectum, and breasts evaluated to look for any abnormalities or possibly precancerous lesions.